guys will be here all day. Good morning. I'd like to call the Human Services Committee to order. Can we please start with the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Can we have roll call, please?
Mrs. Burdick. Here. Mrs. Ricketts-Wales. Mr. Barnes. Mr. Curran.
Here.
Mrs. Hanchett.
Here.
Mr. Stockin.
Here.
Mr. Whitney.
Here.
5 present, 2 absent, and we have a quorum.
Thank you. And can I have a motion to approve the agenda, please?
Hancher will second.
Any questions or comments or changes? All in favor?
Aye.
And that's carried. And then a motion to approve the January 21st minutes, please.
Hancher will move.
Whitney will second.
Any corrections or changes? All in favor?
Aye.
And that's carried. Next up is Director of the Office for the Aging, Anita Madison. Good morning, Anita.
Good morning. First thing on our agenda is our monthly report. A couple of things we'd like to highlight. Total calls at the front desk were at 2,486 for December, compared to 1,955 the previous month. Our health insurance counseling is up 463.5 hours of service versus 483 in November. Keep in mind that open enrollment ended December 7th, so our calls and our service for HICAP, our insurance counseling program, were still up even though we only had 7 days of open enrollment in December. Housekeeper chore, PC level 1, we had 1,220.5 hours of in-home care. That is up from the previous month or the same time last year. And our PC level 2, which is personal care, is at 484.5 hours of service, which is up from the previous month and again from last year as well. Just a few things to highlight.
Thank you. All right.
There are a couple corrections that I'd like to point out on this, and we can send an updated one. At the very bottom underneath total meals, for the previous month, the 1,955 is incorrect. It should be 7,389. Those were added incorrectly. And the next column over where it says same month last year, that 2,095 should be 10,182. So we will send a corrected version for everyone as well.
I thought those looked low.
Yep, they were just added incorrectly. The formula was wrong.
Yep. Okay. Anybody have any questions on Anita's monthly report? All right, so we have a bunch of stuff to approve.
Yep. So the first thing on our agenda is a request for a resolution to accept and appropriate a donation in the amount of $300 from the Wellsville Lions Club. This is to purchase hygiene and personal care supplies for OFA Hygiene Closet. That is a resource for essential toiletries and related items for seniors in need. We would be putting this into our CSE funds under general supplies. And it is, would go under our 6776 or CSE account.
Stockin moves.
Whitney will second.
Any questions? All in favor?
Aye.
That's carried.
Thank you.
All right. Can we block these, the next ones, the agreements for the Go and Dine program?
Yes.
Okay, so we will block the first, 1, 2, 3, 3
Okay.
for Donnie Jean's, Copper Keg, and Aces.
All right, perfect, thank you. Next is a resolution to enter into an agreement for January 1st, 2026 to December 31st, 2026 for Donnie Jean's as a food service establishment for our Go and Dine at a rate of $14 per voucher. This is included in our 2026 contract underneath our nutrition and unmet needs funds. The next resolution that we're looking to enter into is one with Copper Keg in Cuba for the same time frame, January 1st, 2026 to December 31st, 2026. For another food service establishment for our Go and Dine at the rate of $14 per voucher. And the third one is for the same time frame, January 1st, 2026 to December 31st, 2026 for Aces Country Cupboard in Belfast at a rate of $14 per voucher. All of them are under the same funding in our 2026 budget.
Can we have a motion to accept those three?
Hanchett will move.
Curran, second.
Any questions? All in favor?
Aye.
Aye.
And that's carried. Thank you.
Thank you. Our next resolution we're looking to enter into is an amendment to an original agreement with Nescentia Health, which is an MLTC, as a food service provider for our home-delivered meals congregate program. We actually provide the meals that are approved by the MLTC, and we are reimbursed right now at $11.50. We are looking to increase that to $12 per meal, effective January 1st.
We have a motion.
Second.
Second?
Hanchett will second.
Any questions? Does everyone understand what this does? Nita, can you just explain briefly, since we do have some new board members, how this
Sure.
works with this?
Absolutely. So an MLTC is a managed long-term care company. If an individual is over a certain age and meets certain criteria, they can qualify for a Medicare or a managed long-term care company, which can actually provide services such as home-delivered meals. It comes through an authorization from their case or care coordinator to our office, which approves them for however many meals that is authorized. We provide those meals, and this gives us the reimbursement rate at $12 if approved for the meals that we provide to those MLTC clients.
Thank you.
You're welcome.
Any other questions? All in favor?
Aye.
And that's carried. And the next one is a similar.
It is. The next one is also an MLTC, but it is underneath Total Senior Care. They also are an MLTC for our area, and we are looking to do a rate of $12 per meal for them as well, effective January 1st, where we would be reimbursed $12 per meal that we provide.
We have a motion to approve that one.
Whitney will move.
Second?
Hanchett will second.
Any questions? All in favor?
Aye.
And that's carried.
Thank you. We are looking to enter into an agreement with the Center for Elder Law and Justice of Buffalo to provide legal services for our seniors of Allegheny County, age 60 or over. This is at a rate of $75 per unit, which is 1 hour of service, with a maximum of $12,000. There is no rate increase from our 2025 rate. They did not increase their rates. This is included in our 2026 budget underneath legal services.
We have a motion?
Stocking moves.
Second?
I'll second. Curran?
Any questions? All in favor?
Aye.
And that's moved. Okay. And,
Next, we're requesting a resolution to enter into an agreement with Legal Assistance of Western New York, or Law New York, to provide legal services for older adults. Again, this is at a rate of $158 per unit, which is 1 hour of service, up to $12,000, and this is not a rate increase from 2025. This is what our 2025 rate is, and it is underneath our legal service in our budget.
a motion, please?
Curran?
Stocking second.
Any questions? Anita, I just have a quick question. To what extent do they provide, I mean, they don't do wills or anything like that, or do they?
Yes, so if somebody is eligible for the program, because we do have a small pot of money to be able to provide legal services, if they have no other ways to pay for like a will, power of attorney, healthcare proxy, they can be advocates for or answer questions for housing concerns, really any senior issues, elder issues.
Okay, great. Thank you. Any other questions? All in favor?
Aye.
Aye.
And that's carried. And our contract with our dietitian, I believe, is next.
Yep. We are asking permission to enter into a contract with Erica Zerkowski, who is our registered dietitian. I'm not going to go through all of her initials behind her name, if that's okay. And this is to provide the nutrition services program with our minimum requirement of at least 16 hours per week, which is required by our New York State Office for the Aging Standards. The term of this contract would be January 1st, 2026 to December 31st of 2028. at a rate of pay of $60 per hour. That is not a rate increase from her 2021-2025 contract, so she kept the rate the same. It is included in our 2026 budget underneath our nutrition programs.
I have a motion to approve that.
Hanchett will move.
Do you have a second?
Stockton.
Any questions? Is she still doing her Facebook Live posts?
She is. We moved the date, or the time. It's in the evening now. It's at 7 o'clock in the evening, because we had actually some of our congregate participants request that it was not while they were meeting to have lunch, because they wanted to watch her as well. So we did change the time to an evening.
That must be why I'm missing it. Okay, good. Yeah. All in favor?
Aye.
And that's carried. And now we have two RPFs, right? Or RFPs,
Two.
rather, sorry.
Yep, last two. All right, so the next request that we have is permission to conduct a request for proposal or an RFP for our PERS, our Personal Emergency Response Systems. The original agreement that we entered into on August 1st of 2025 is being terminated effective April 30th, 2026. The reason for the termination is because U of R Medical Noise will no longer be providing the medical alert program effective April 30th, 2026. So the Allegheny County Office for the Aging is requesting permission to receive proposals for our next PERS contract.
We have a motion, please.
Whitney will move.
Second.
Hanchett will second.
Any questions? Anita, if you go to a different company, that means that they have to go in and remove the old PERS and put in that company's again, like we did last time?
Yes, so when we go out for RFP, the provider that provides the equipment to Noise is Medical Guardian, and they are on the list. Whoever wins the bid, if it's not Medical Guardian, then the equipment would have to be swapped out. If it is Medical Guardian, then the equipment would remain the same. So it will just depend on the RFP process and who wins the bid.
Any other, yeah?
Is this something that we normally do on a yearly basis, or?
No.
Okay.
And no, we were hopeful that we would have stayed with Noise, but U of R had chosen to terminate that program, and so it terminated our contract.
Okay, thank you.
You're welcome.
Any other questions? All in favor?
Aye.
And that's carried. And finally,
Okay.
The
Our
big-
last item for today on the agenda is a request for permission to conduct a request for proposal or an RFP for our home delivered meals program and our congregate senior luncheon centers, our nutrition program. The agreement with our current vendor has a term of January 1st, 2026 to December 31st, 2026. The purpose of the request is to conduct an RFP to solicit proposals for prospective vendors for the associated cost and the ability to perform. We're looking to gauge both interest and ability.
can we have a motion, please?
Curran?
Second? I'll second it. Any questions? No questions? Okay, all in favor?
Aye.
Aye.
That's carried. Anita, how many of those do you send out? I do have a question, sorry.
No, that's okay. How many RFPs do we send out? The last time we did it, we actually sent out about 30. I take that back. For the meals, I think it was 40. We only received a handful back. But we do send them out to any vendor. And then it just depends on who sends them back.
Okay. Thank you.
So I did have two things that I'd like to announce, if that's okay.
Yep, go ahead.
We do have a date for our picnic, which is Tuesday, August 4th, with an extreme weather date of Wednesday, August 5th. If it's raining a little, we're still going forward because it's too big to try to cancel. So if you want to mark that down on your calendars, you'll be getting an invitation before too long. And then the next thing you'll be receiving an invitation for is our March for Meals is coming up. The week of March 23rd to the 27th will be the week of March for Meals. And we'll be inviting all of our legislators, department heads, and elected officials to join us on our routes or at our congregate locations throughout that week. So people will be getting an invitation for that, and our seniors will hopefully see you out in the field.
Thank you, Anita. I encourage everyone to join in on that. It's enlightening. All right.
thank
Anybody
you.
else have any questions for Anita? right, thank you, Anita.
Thank you.
Next up is Public Health Director Tyler Shaw. Welcome, Tyler.
Good afternoon. Just a couple highlights from my monthly report. You'll see on the first page our medical services have increased compared to last year. That is primarily due to having a full-time nurse practitioner, which is great news. So we're seeing those medical services increasing. You'll see some actual testing down below that has also increased, likely due to the number of patients that we're seeing. So we're seeing all those numbers going up. Last but not least, in our monthly report, just to highlight, we have had 2 positive rabies specimens already in 2026, and I expect that number to increase as the weather starts to become nicer. But we've had 2 raccoons positive in the Belmont area, so be on the lookout for some rabid animals out there. Just something off the monthly report, our 2025 annual report. I do have a copy here if anyone wants to see it. I did file that with Brenda, and that should be coming out shortly.
All right,
Questions?
and you have a couple things for us to approve?
Yes. First is our agreement with the First Step Family Resource Center, Ardent Solutions, for a facility use agreement. We use this agreement primarily for different programming. We've done flu clinics there, lead poisoning prevention testing, and some of our children's services programming as well.
Can we have a motion to approve that?
Hanchett will move.
Curran, second.
Any questions? All in favor?
Aye.
That's carried. And then we have.
Next up is an agreement with Rochester General Hospital for Rochester Regional Health Laboratory Services. Since we don't run our own laboratory for all of our various medical services, we do have to outsource that.
Motion?
Stockton.
We have a second?
Whitney will second.
Any questions? All in favor?
Aye.
And that's carried. And I believe you have one more.
Last but not least is our engineering review contract with Thornton Engineering. And this is for reviews of larger projects like municipal drinking water systems. If there's a new restaurant or build, swimming pool enhancements, it is required to be reviewed by a licensed engineer.
We have a motion, please.
Curran,
Second?
Hanchett will second.
Any questions? All in favor?
Aye.
And that's carried. How is the WIC clinic move going?
Slowly but surely we will
Okay.
get there.
Okay.
I was just there on Friday, lots of stuff shredded and boxed up, just getting rid of some stuff, lots of dump runs. So yeah, everything, all their paperwork is getting boxed up at this point. Kind of the last thing will be some desks and things to be moved at the end, so yeah.
I see the cubicles are already up and in place, so
Yes,
looks
thanks
good.
to DPW for all that work, yeah.
Okay, good. All right, thank you, Tyler. Any
Thank
other
you.
questions for Tyler today? Thank you.
Thank you.
All right, we have Mr. Horan, Commissioner of Social Services. Welcome, Don.
Good morning. First off is the monthly report. All of our numbers are pretty consistent. The one that I would like to draw your attention to is on the first page, food stamp only. That dropped by 46 cases. As you recall, the waiver for ABOD had been canceled by the federal government, and there was a possibility that could have started December 1st. We're not sure that many cases dropped off because of that. There's no mechanism to track that. But in the next months, you'll see where that number jumps right back up. So,
Are you still having to certify that they're eligible?
yes, that's official March 1st
March,
now.
okay.
So, and we have another class going through now, and we had everybody certified that did show up. We sent invitations out to everybody. Not everybody showed. We made sure they had transportation and everything. We did our due diligence.
Great, thank you.
Okay. Also on the first page, you'll see that our number of children in care dropped by 2. That's because we had 2 adoptions in December. It's always good to report on good things. These kids will have a new life and new parents moving forward.
Nice.
So, the only other thing I'd like to do is give you an update. I know we talked a lot about the funding freezes from the federal government at our last meeting. We are not receiving information from the federal government. The state's very limited. I did get a NYPWA update. There is an injunction And in that injunction, it says that we will still receive our funding, and they're going to fight out the legality of whether the federal government can cut that funding or not. That's about all we know on that.
But you haven't actually received funding.
Oh, we're still getting settlements.
still
Yes,
getting,
we
okay.
are still receiving funding.
Okay, good.
So, any other questions on that?
I just wanted to mention the Code Blue. There's been a lot of cold nights.
Oh,
so
yes.
I'm guessing that you've been pretty busy finding places for people.
Yep, we're able to house everybody. We're using mostly the 4 motels that we use in the county: Cuba, Wellsville, and Alfred. So,
Any other questions on the monthly report? All right, then we will move on to your contract.
yep. We would like to be able to renew our contract or enter into contract with Mr. Jason Burles over in Angelica. This is for our homeless apartment. This is where we place our homeless people. We don't like to put them in the hotels. Last year, we utilized that location for 330 nights out of 365 last year. So that's a huge savings instead of putting somebody in a hotel or a motel.
Is that the same person?
No, it was 23 different people.
Oh,
So,
okay. Can we have a motion?
I'll make the motion. I also have a question.
Okay, second?
Second.
Okay, Mr.
Hanchett.
Stockton?
Is it just one person apartment or is it multiple people there?
excuse me. It is one room, but we'll put multiple people in there. We'll double up, same sex. So there's no TV, no Wi-Fi, no nothing. It's kind of an incentive to do your independent living program, go find an apartment, and get on the road to self-sufficiency.
Mr. Healy?
Thank you. How many apartments totally do we rent for the homeless?
We have 4, including right down here in Belmont.
Okay.
There's 3 units down there, but we can house 4 people.
All right. So we have contract with 4 landlords, and is that correct?
Yes, for both.
Around the county, they spread out around the county, I assume?
The homeless is just Belmont and Angelica, but Code Blue, and if we overflow on homeless, then we'll spread them throughout the county at the hotels and motels.
Thank you.
Any other questions? All in favor?
Aye.
And that's carried. Anything else for today, Don?
No?
Okay.
All set?
Mr. Healy?
I got a question on Medicaid there that maybe you can answer. So we know that drives a lot of our costs in more ways than one on the county level. Medications, did they cover all medications? I mean, would they cover Ozempic and the weight loss drugs also, or they only have certain drugs that they cover?
I would have to check into if they were covering the specific drugs that you're mentioning. We don't pay those from the local level. All those bills go electronically to the state. And then whatever they have on their approved list, I could check into that to see what they are covering and what they are not covering.
It's part of the prescriptions are part of the Medicaid
Oh, yes,
program.
absolutely they are.
Yeah, I appreciate that. Thank you.
Yep, okay.
Any other questions? Okay, thanks, Don.
Thank you.
All right, next up is Dr. Anderson. Welcome.
I'm going to see if I can be as quick as I was last time when you just tabled everything and told me to go on my way. I would like to take these in a different order than you have them on there. I'd like to start with the office manager, request to fill the position of office manager. This is a full-time, it's an existing position. There's really no county cost in this particular position.
Dr. Anderson, before you go on, we have to have a motion to take them off the table since they were tabled.
Oh, I'm
And-
sorry,
Well,
of
that's
course.
okay, I should have stopped you sooner. So if we can have a motion to take these off the table, please.
Hanchett will move.
Do we have a second?
Kern?
All in favor?
Aye.
And that's carried. So now we can discuss them.
I was following my own Robert's rules and just thought I'd go ahead. Any questions about this one?
This is the office manager,
Yes.
and this will go from part-time to full-time, right?
This is a full-time position. We are going to move our current senior typist into this position. Okay?
All right, can we have a motion to approve that?
Hanchett will move.
Do I have a second? Any questions? All in favor?
Aye.
And that's carried. All right, which one did you want to do next?
Then I wanted to do the part-time,
Okay,
the create and fill the part-time office manager.
okay. Can we have a motion for that one?
Second.
Second?
Whitney will second.
Any questions? All in favor?
Aye.
And that's carried. And finally, the main one.
And the last one is to create and fill the Deputy Director of Community Services.
Can we have a motion?
Hanchett will move.
Kern, second.
Any questions? I just want to make a note that Dr. Anderson and Carissa and a couple other people, including Lindy, met regarding these, including Bobby, and have developed a way to move forward with these. So we have done the homework. So all in favor?
Aye.
And that's carried. Thank you,
Thank you.
Doctor.
Thanks very much.
Okay. Clerk of the Board, Brenda Rigby-Reilly, we have some things from her today.
We do. The first one, the Community Service Board recommends that Janice Burdick of Alfred be reappointed to a 4-year term commencing January 1st, 2026 and expiring December 31st, 2029. This will require a motion and a resolution.
We have a motion, please.
Hanchett will move.
Kern, second.
Any questions? All in favor?
Aye.
And that's carried. Thank you.
The chairman of the board plans to reappoint the following as members of the Citizens Advisory Council to the Office for the Aging for a 3-year term commencing January 1st, 2026 and expiring December 31st, 2028. And these are subject to confirmation by the board. Over 60 members, Carol Onata, David Pullen, Mary Ann Trice, and William Koch.
We have motion to appoint those four.
Whitney will move.
Is that a second? All in favor?
Aye.
And that's carried. Thank you. Do we have any unfinished business today? New business? Good to the order? I will take a motion for adjournment, please.
Hanchett will